Hello, my name is Glenda Brown, and my topic today is diabetes. I have type 2 diabetes, and I was diagnosed approximately a little over 10 years ago. And I was very unfamiliar with the disorder, as no one in my family ever had diabetes to my knowledge. So it was a rude awakening for me as well, and I'd like to provide you with some hopefully informative information today. This is by What is Diabetes? So what is diabetes? When you eat, your body turns food into sugars or glucose. At that point, your pancreas is supposed to release insulin. Insulin serves as sort of a key to allow your glucose to enter and open your cells, and allows you to use the glucose for energy. But with diabetes, this system doesn't work or doesn't work correctly. Some types of diabetes I will briefly describe for you. Type 1 diabetes, formerly known as juvenile onset diabetes. It is not the case anymore because you can actually get type 1 diabetes at any age now. And that is when the pancreas releases very little or no insulin. And so if you have type 1 diabetes, you are certainly required to take several injections per day of insulin as regular blood monitoring as well. Type 2 diabetes, formerly known as adult onset, typically arises after the age of 40, which was in my case. However, that's not the case anymore either. There are actually juveniles that have type 2 diabetes. So the two have kind of blended in with each other now. In type 2, your body can still release the insulin, however, not enough to have it work correctly. So usually with type 2, medication and a healthier lifestyle and exercise and losing weight, you will be able to live with type 2 diabetes and maintain a healthy lifestyle, and while keeping it under control. The causes. Some of the causes for diabetes, according to staff, is type 1. They believe that it's possibly genetic, although they're not quite sure. Type 2 has more of a genetic link, but is more linked to lifestyle and environmental causes, as in my situation. Some statistics about diabetes from Statistics About Diabetes. Undiagnosed. Of the 29.1 million, 21 million were diagnosed and 8.1 million were undiagnosed. Prevalence in seniors. The percentage of Americans aged 65 and older remain high at 25.9%, or 11.8 million seniors diagnosed and undiagnosed. New cases. 1.4 million Americans are diagnosed with diabetes every year. There's prediabetes. In 2012, 86 million Americans aged 20 and older had prediabetes. This is up from 79 million in 2010. Deaths. Diabetes remains the 7th leading cause of death in the United States in 2010, with 69,071 death certificates listing it as the underlying cause of death, and a total of 234,051 death certificates listing diabetes as an underlying or contributing factor of death. Though diabetes can be fatal if left untreated, by no means it has to be. Preventing diabetes. There are ways you can prevent becoming a diabetic. If you have a family history, by watching your diet, exercising, you may ward off diabetes. Get more physically active. Change your diet, more fiber, whole grains. Lose some extra weight. In conclusion, I would like to conclude with a few valid points. Diabetes will change your life, but doesn't have to ruin your life. Lifestyle changing, checking your blood sugar, and seeing your doctor often can help greatly. I hope I've provided you with some helpful facts and stats about this serious but manageable illness. Thank you for your attention today. Thank you.